So related to the point that I'm going to present on the 18th of March this year, it's going to be the burden of the haemopathy in the NCC. Um, Normally, we have a long data that we have since 2013, but I just bring out only the file last year that related to the haemopathy and the amount of the patients come to come to our center for the treatment, and as well to devise which area that they're coming from, the various location from the country. Another thing is related to the demography of the haemopathy that we can find and the type of haemopathy. Uh, One more thing is related to the haemopathy type, which is the pathology that we uh, see every day. And secondly is cover about the management that we have and available in our National Cancer Center, which is the feasible medication or the available immunotherapy or the treatment that is available on site for treating the patient. And also we are talking about the human resources related to our management of the haemopathy in our country, especially in National Cancer Center, which is the first and the only place to do the treatment properly of the haemopathy in our country. Another thing we'll show you guys a little bit related to our facility in our National Cancer Center, including the room, some procedure related to the platelet apheresis that which is available only in Cambodia as the public hospital who is covered for this one, and it's helped easily for the treatment of the haemopathy in the country. Uh, One more thing, and the last one, we are talking about the vision of our planning in the nearest future that we are going to do the autogenous transplant, bone marrow transplant for our patient and started from multiple myeloma. Unfortunately, we don't have any exact data who represent our country of cancer disease, but for sure that day after day, uh, we are seeing a lot of patients coming with the cancer disease, not even in the Carmet Hospital, but over the nation, I think. But most of the time, the patient come in the final stage or the advanced stage already that we cannot do any uh, what we call the effective. We are very effective to cure the patient at the early stage. And honestly, we don't have the campaigns or the program of the cancer prevention, but for sure that our ministry and Ministry of Health and with our cooperation from various hospitals, I think that the program of cancer screening is going to put on place very soon. Nowadays, we are running the campaign of the cervix cancer, which is number one for the woman cancer in Cambodia, that affects most of the cancer of the woman. So that for sure that the cancer in Cambodia is very, very concerned that everyone need to be aware of, and everyone need to help each other, especially for the oncologists and hematologists in Cambodia. Even we have a little amount of the oncologists on site on in the country, but hopefully that we will bring more and more oncologists to help each other. I would like to ask everyone, especially the other GP around the country to participate. At least we know that in Cambodia we have a place and we have a National Cancer Center uh, who can give and can provide the cancer care for our patient to avoid the leak of the patient, we can say like this, because some patient go abroad, especially to the neighbor country, to have the treatment, which is really difficult. One is related to the language, another one is far from the house, and the spend of the patient as well. And we are now capable to do the treatment for our patient, and for sure that we will help each other. This is the thing that I want to inform other doctor in Cambodia. And one more thing is to the patient as well. So because our Cambodian people might say that if they have the cancer, they would be die. Uh, this is the problem. But some stage of cancer we can cure as well, and we can give support of care for them. Even it's not 100% curable, but it can help.